Welcome to TachyHealth, an end-to-end visibility platform that helps track and detect medical claims. Today, I want to show you how to use our business intelligence tool. So you log in using the username and password provided. And as you can see on the left side panel, you have a couple of features. We're going to click on Insights. Now, the Insights, or the Business Intelligence tool, is fetching real-time data from medical claims, and we have a couple of features and panels for financial insights and successful KPIs. But before that, I want to focus on our great filtration search criteria. So, for the different business needs or different medical auditing needs, we have provided an excellent criteria search for the whole team to use. By just one click, the information will change. For example, if I click 2021 or 2022, you can see the data changing accordingly. Same for the month. Or I can also have a specific provider with a specific service within that provider. So after clicking on that, all of these data are specifically chosen according to this. This can also be done for inpatient or outpatient, also by location. All of this tailored for the business needs and the different criteria. Now, on the very first panel of the financial one, you have a couple of highly visualized financial insights, including the total price requested. Now, when I hover, you will have more insights like the price requested, the amount paid, rejected, and we also take into consideration the patient share. So, upon clicking a certain provider, you can see the changes in total requested quantity, average unit price, average paid claim, and so on. All of these are just dynamically changing based on each provider that I click on, and by clicking outside, you can see the whole image you have here, the amount accepted and rejected with different colors for your convenience. Moving to our hierarchical tree where you have all the amount paid and you can investigate further with a certain provider, certain practitioner within that provider, certain service, and so on. All of these are arranged for you by the most costly ones. You can scroll down here to see more or to investigate further as well. Now, this is for the financial view. Now moving to the KPIs panel, tailored specifically for you, where you can see the full adjudication rate for the accepted, invalid, and rejected ones, where everything is organized and categorized. For example, if I go to the procedure, the accepted ones are represented by the blue color, and we're also providing them a piece code and the rejected ones as well. Also, you can have it done by provider, and check here all the medical claims as well with the invalid rejected and everything. It's showing a lot of highly visualized data for that part specifically. And as you can see here, when I hover on the number, you have the accepted, invalid, and rejected by the denial code. Moving to the utilization part, I can actually have the top 10 procedures, and I can click on that to investigate further. Also, having the most costly patients with the outliers or the suspicious activity. And when I click on a certain point, you can see that the data changed automatically to help in further investigation, like why was this a suspicious activity, and then same for the anomaly. You have here a certain kind of criteria, and then by clicking on the scroll or ruler, I can have a closer look and can actually investigate further. Also, I have here on the medical claim records data, the diagnosis, the standard code paid or rejected. So, all of this is considered the normal range, and you can see the highlighted or the different ones are the outliers. Moving to the network part, you can actually see certain patients and their account of visits. You can investigate further in the procedure, the most costly ones per provider or per patient as well. Now, for the provider one in a highly quick view, you can see here when I click or hover over this point, the duration that the patient has stayed in, and you can also track that for the whole team. And also you can have it per policy number. For example, on this one, you can see here, I have this policy number chosen with a certain practitioner ID, and all of this are just automatically changed in the system. Also, down here, the most costly doctors as well. Thank you so much for using our business intelligence tool. I hope this helped.